Hello, our project is titled Treatment Without Judgment. Our project was focused on substance use disorder and expert education. Presenting today are Melanie Solar, Sarah Policini, and myself, Phoebe Goodale. So a little bit of background. The problem that we identified is that currently nursing professionals report feeling uncomfortable providing care to patients with substance disorder due to a lack of education in this need population. Responding to our problem, we're asking in undergraduate nursing students, does expert education result in changes in comfort level towards patients with substance use disorder? And then in order to follow along with our research, these keywords are very pertinent to understand. So substance use disorder is defined as a disease that affects a person's brain and behavior and leads to an inability to control the use of illegal or illegal drugs or medications. And then SBIRT stands for Screening, Brief Intervention, and Referral to Treatment. And it's an evidence-based approach to identify patients who use alcohol and other drugs at risky levels. And then for our methodology, we sent a pre-survey to a class of third-year undergraduate nursing students. Then we presented our education plan that included a detailed background on what substance use disorder is and what it looks like. We detailed SBIRT, the screening and intervention tool used, and how to implement SBIRT into care. We then sent them the same survey as a post-survey, which is pictured on the right.
Our pre and post survey asked the same 11 questions with a prompt for 5 additional questions in the post survey, which were specific to the educational teaching provided. After presenting to the class, we had a total of 74 students complete our pre-survey, with 60 students responding to the post survey, and 1 student's answers from the post survey were excluded due to not all the questions being answered, so the post survey was taken out of 59 students. Our results showed in the pre-survey that students did not feel comfortable caring for, assessing, or referring patients with substance use disorder, with only 28%, 51%, and 48% of students respectively prior to the education session reporting comfortability. This is shown in the blue graph lines in the chart above. Following the education session, we found increases in all of these areas, with 83%, 88%, and 78% of students respectively reporting comfortability with caring for, assessing, and then referring patients with substance use disorder. We had a total of 74 complete the pre-survey, which revealed that our audience had almost no education on the SBIRT tool and also minimal comfort with the care and treatment of patients with substance use disorder. 60 students completed the post-survey, which then revealed that after the presentation, their familiarity with SBIRT increased and their knowledge of the treatment also increased.
Based off of all our results, we concluded that after the education was provided, undergrad nurses felt more comfortable caring for those with substance use disorders. Our recommendation would be that education surrounding the SBIRT screening tool and substance use disorders be an integral part of undergrad nursing programs. If this education were to be provided in more programs, more new nurses in the workforce would have a better understanding of SBIRT and substance use disorders. We would also suggest that more education regarding referrals to treatments and other care options be included, because the question pertaining to comfort surrounding this issue had our least amount of change from the pre to post survey. Another suggestion would be that we provide a SBIRT simulation during the education piece. This is specifically for students who benefit from more visual learning and really for any student to see a real life scenario using the SBIRT screening tool. Lastly, we would suggest that the future study provide a greater focus on minority or specific patient populations in regards to substance use disorders and SBIRT.